This combination of vitamins provides essential nutrients to support overall health. Folplex 2.2 contains vitamin B6, vitamin B12, and folic acid. These vitamins are important for people who may not be getting enough of them through their diet. It is used to treat or prevent vitamin deficiency due to poor diet, certain illnesses, or during pregnancy. The recommended daily dosage may vary based on individual needs, so it is important to consult with a healthcare professional for the best advice. It is typically taken once a day with a meal to help with absorption. You can take Folplex 2.2 by mouth, with or without food, usually once a day as directed by your doctor. If you experience stomach upset, you can take it with food to help alleviate any discomfort. It's important to use this medication regularly in order to get the most benefit from it. To help you remember, try to take it at the same time each day. The dosage will depend on your medical condition and how you respond to the therapy. Be sure to follow your doctor's instructions for the best results. Some common side effects of Folplex 2.2 include nausea, stomach upset, diarrhea, drowsiness, flushing, and numbness/tingling. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. It's important to remember that if your doctor has prescribed this medication, they have made the judgment that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects, but it's important to tell your doctor right away if you experience any mental/mood changes or unusual weakness. While a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you experience any other effects not listed, it's important to contact your doctor or pharmacist. As always, it's important to consult your doctor for medical advice about any side effects. Before you start taking Folplex 2.2, it's important to talk to your doctor or pharmacist if you have any allergies, as this product may contain ingredients that can cause allergic reactions. Make sure to discuss your medical history, especially if you have certain blood disorders. This medication may cause drowsiness, especially when combined with alcohol or marijuana. It's important to avoid activities that require alertness until you know how this medication affects you. If you are using marijuana, be sure to have a conversation with your doctor. If you are pregnant, use this medication only if it's clearly needed and discuss the risks and benefits with your doctor. It's also important to consult your doctor before breastfeeding while taking this medication. The daily dosage of Folplex 2.2 will be determined by your doctor based on your medical condition and response to treatment. It's usually taken once a day, and the best time to take it is typically in the morning. Be sure to follow your doctor's instructions carefully. It's important to be aware that Folplex 2.2 can interact with other medications, which may affect how they work or increase the risk of serious side effects. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor first. Some products that may interact with Folplex 2.2 include altretamine, cisplatin, levodopa, when used without carbidopa, folic acid antagonists, such as methotrexate, and hydantoins, such as phenytoin, diphenylhydantoin, pyrimethamine. In addition, Folplex 2.2 may interfere with certain lab tests, potentially leading to false test results. It's essential to inform lab personnel and all your doctors that you are using this product. As for the daily dosage, it is best to follow your doctor's instructions. The optimal timing for taking Folplex 2.2 may vary, so it's important to consult with your healthcare provider to determine the best time for you. If someone has taken too much Folplex 2.2 and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. When taking Folplex 2.2, it's important not to share this medication with others. Your doctor may also want to monitor your progress with lab tests such as complete blood count and homocysteine levels. Be sure to attend all medical and lab appointments and consult your doctor for more details. It's best to get your vitamins and minerals from healthy foods, so maintaining a well-balanced diet is important. B vitamins, including folic acid, can be found in leafy greens, other vegetables, and citrus fruits, as well as enriched grains such as bread, pasta, and cereal. Some brands of Folplex 2.2 may contain additional ingredients like vitamin E, para-aminobenzoic acid, or alpha-lipoic acid. If you have any questions about the ingredients in your specific brand, be sure to consult your doctor or pharmacist. If you forget to take a dose of Folplex 2.2, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Take the next dose at your regular time. Don't take double the dose to make up for the missed one. When storing Folplex 2.2, make sure to keep it at room temperature and away from light and moisture. It's important to avoid storing it in the bathroom and to keep it out of reach of children and pets. When it comes to getting rid of Folplex 2.2, don't flush it down the toilet or pour it into a drain unless you're specifically told to do so. Instead, make sure to properly discard the product once it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper way to dispose of it. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.